Welcome, everyone, to the Future of Work Leadership Conference presented by the Bellevue Chamber of Commerce. I'm Chris Falco, a partner at Falco Consulting Company here in Redmond, Washington. Longtime member of the Chamber, been on the board for many years and a past chair. Just kind of give you an update on what, from an accounting firm perspective, of where things are going in this pandemic. We've had an interesting year, as I'm sure many of you had. Ours has been a little different than some because we're while we still have a busy season when it comes to taxes and year-end financials and audits and things of that nature, it's been very, very different. Never have we had a situation where we've had 4 or 5 different tax changes all in the middle of a tax year, trying to juggle things through the PPP program. And so it's been very interesting for us and for our clients, and having to work remotely and trying to manage that process and help them through it. It's been very unique. I thought we'd never see something like 2008, 2009 again when it came to an interesting way to have to work, but we did. Excuse me. So I hope everyone is able to continue managing through this. Keep tuned to your TVs, your radios, your internet, because Congress hopefully will come back with something here by the end of this week, which is today, or sometime next week, we're hoping, as it relates to additional stimulus. And there's a lot of different things that they're talking about related to the PPP, which could impact how things go forward for the next, at least through the end of the year. At this time, I'd like to now hand things over to Joe Fain, the President and CEO of the Bellevue Chamber, and he will update us on what's been happening at the Chamber. Take it away, Joe.
We're happy that you're able to welcome everyone to the program today, and we are very appreciative of your continued support and loyalty to the Bellevue Chamber. Today is the 8th in our summer series featuring the top minds focused on the future of work. We are getting close to wrapping up with our final session taking place next Friday, August 14th, and it's going to be another must-see. We remain glued to everything pandemic, but we're often left feeling yanked around by bad models, political spin, and breaking news that is more broken than it is news. To cut through the noise and to tell us what comes next is former Food and Drug Administration Commissioner and Director of Duke University Center for Health Policy, Dr. Mark McClellan. The Future of Work Leadership Conference is going out on a high note, so don't forget to register using the link on your screen. We also want you to save the date for other extraordinary speakers and programs we're hosting this fall. Each year, our Economic Forecast Summit, sponsored by Bank of America, fills the Hyatt Regency in Bellevue. This year, we're filling your living room. In addition to our world-class keynoter, economist, and Bank of America Chief Strategist Joe Quinlan, we're adding a choose-your-own-adventure element. On your screen is a link to a survey with 11 program topics for our breakout sessions. Based on your feedback, we'll be filling our breakout programs with speakers or panels from the top 5 topics you select. So vote now and make sure you save the date, November 17th, 2020. Now, don't forget to post on social media about your experience as a Future of Work Leadership Conference attendee by tagging @Bellevue Chamber. We'll be monitoring Facebook, Instagram, and LinkedIn throughout the program, and we'll randomly select one poster to receive 150 cloth masks and 5 bottles of sanitizer provided by our generous partnership with the King County Office of Emergency Management. Finally, I'd like to thank our sponsors and table captains who are generously supporting this series, starting with Amazon as this year's Future of Work Leadership Conference presenting sponsor. Amazon has been at the front lines of COVID response on the East Side and around the country by supporting local small businesses and restaurants through their generous grant program, to partnering with us alongside chambers across King County in distributing sanitizer and masks to thousands of businesses and residents. The City of Bellevue, the Bellevue Chamber of Commerce, and so many across our city are excited to welcome Amazon's growing presence here on the East Side over the coming years. We also want to thank our major sponsors, AT&T, Microsoft, Puget Sound Energy, King County, the City of Bellevue, our corporate sponsors, Falco Salt and the Port of Seattle, and associate sponsors, ACES Northwest Network and the University of Washington. We also couldn't make this happen without our virtual conference table captains, including HDR, Seattle Children's, AAA of Washington, AR/VR Studio, the Partners Group, Sweeney Conrad, GMI, Her Interactive, and Accelerate. Before we get going, I want to remind you that this is an interactive program that thrives on your participation. Today's presenter will be taking questions at the conclusion of his remarks, so fill that chat box and use the Q&A feature to get the conversation started. Now, I would like to hand things off to one of our longtime supporters of the Chamber, Chief Development Officer for Overlake Medical Center, Molly Stearns. Welcome, Molly.
Thanks, Joe, and hello, everybody. I get the honor of introducing our speaker, but before that, I was asked to do a quick update on Overlake and how we are dealing these days with the pandemic. It's been, of course, 5 months since we saw our first case here, and the county began to realize what we were dealing with. But it certainly has demonstrated the importance of Overlake to our East Side residents and employers. That, of course, as a fundraiser for Overlake has helped me provide a case that people really do understand. In addition to being accessible to our community when we were most needed, we're proud of the high quality of care that we've been able to provide to all of our patients, including those with COVID, and how we've been able to protect our frontline caregivers. We've been highly successful getting patients off ventilators well above the national average. Our staff infection rates remain well below the national average, and we've been able to offer our patients on the East Side the latest in treatments and therapies along the way. As everyone knows, we're far from out of the woods with this virus. At our peak in late March, we had a census of 72 patients here with COVID. By late June, the patient count was in the low single digits. And although the East Side has not yet seen another spike, which we're of course watching very carefully, we do see a recent bump, a definite bump in cases here with 11 patients in-house yesterday. As an organization, we're really working to learn from from what we have been dealing with, and which has put us in a very different position from the early days when we were all struggling across the country, all the healthcare providers, with figuring out how you approached and dealt with all of this. We've learned a great deal about how to manage the cases both operationally and medically, and we're maintaining a constant state of readiness. We've also added significant testing capability, including an in-house molecular lab, so we're not as dependent on those external testing companies where we have all heard about those long wait times. We've also continued to add to our supply inventory so that we can withstand another surge, and this has been greatly helped by the community, which continues to drop off boxes of all sizes of PPE, which we really do use. Finally, the summer breather has allowed us to refresh. Our teams have been able to refresh and recover for what, for most of them, was an incredibly challenging time, professionally and personally. I could go on and on about Overlake's response, and happy to talk at a later date about that. But we're here this morning to hear about telemedicine, which obviously rapidly proved itself during the heat of this crisis, and we will continue to see changes in healthcare as a result. With us today is Davide Vigano, who's CEO of Sensoria, a company that produces wearable biosensing garments, and that is an innovator in the telemedicine world. Davide is a former Microsoft partner-level executive with 30 years of extensive product management, marketing, and sales experience. He joined Microsoft in 1987 as an intern, and in his last role with the company served as partner-level general manager of the Health Solutions Group, where he was in charge of a product strategy for both Health Vault and the Emolga product lines before they were then sold to GE. Davide holds a master's degree in business and economics from the University of Bergamo in Italy, and holds marketing and executive education certificates from both the Kellogg School of Management at Northwestern and the University of Washington. So Davide, we're anxious to hear what you have to say. This is a changing world, and we'll learn from you. Thank you.
Well, thank you, Molly, and thank you, everyone. I think it is a challenging world, and it is exciting to hear what Overlake has been able to achieve in such an amazing and short time. So my goal today is to actually walk you through the technology aspect of how the pandemic has impacted the technology that is related to delivering healthcare and delivering quality healthcare. So I will talk about both the healthcare aspects, but also hopefully more interesting for most people in the call here, the employer aspect and population health management of the employee base that we see happening both in Europe and here in the United States. So Sensoria, just a brief introduction on what we do, is focused on one thing only, which is called human augmentation. But what is human augmentation? It's really injecting sensing technology into whatever we wear in the morning. So we all wake up in the morning, we take a shower, most of us, and then we tend to wear clothing, garments, and footwear. So wouldn't it be nice if wearable technology and sensors were infused into whatever the patient wears in the morning? Of course, the compliance and adherence challenge has plagued the medical device industry for many, many years. And by actually having the sensors into whatever the patient or actually the consumer before he or she becomes a patient wearing in the morning could be hugely, hugely valuable, both from a predictive analytics standpoint and from a diagnostic and interventional standpoint as well. So we have built a remote patient management system in the cloud based on Microsoft Azure. We have been working on this for a while. My partner and CTO is a former Xbox Live program manager. So as you probably know, Health Vault and the Xbox Live were the genesis of Azure. So we tend to actually test all the alpha code for each one of the IoT components of Azure for Microsoft. And the goal is really to help textile and footwear companies go through digital transformation and inject those sensors where they belong so that we can get meaningful health-related data to make diagnostic and interventional decisions. You can find more information on us on sensoriahealth.com. But so let's go and talk about technology and the impact of COVID-19 on the technology aspect of how we deliver care. So as you probably know by now, and other countries have realized, and as Molly just mentioned, we're not out of the woods yet, right? So this is a nasty virus, as Dr. Fauci referred to, COVID-19, just the night before yesterday. Even countries that have been extremely successful in the first wave of the virus in controlling the pandemic and the number of infections and the hospitalization rate, and of course, at that point, the mortality rate, like South Korea, are facing a second wave right now. At the end of June, the South Korean government officially stated that they are now in the second wave. Of course, the numbers are very, very, very small compared to the US, both on in terms of the percentage of the population and in terms of other indicators, but still, this is a virus that will stay with us for months to come. So we need to prepare for building what we call the new normal. There is nothing to go back to. It's really all about building this new normal. So how is healthcare getting equipped to actually deal with this with these challenging times? What you see here is the impact on the number of procedures specific to each specialty in the United States in the last few months. What you can see here is the substantial, I would say, enormous decline in number of procedures for some specialties such as ophthalmology, ear and nose, dermatology. Each one of those is down over 70% year over year. So if you can imagine the impact on some clinics and hospitals as well in terms of the revenues, if they have still a fee-for-service type of model, this is material and very, very impactful on their revenues. Other specialties, of course, are not as impacted, although talking about a 50% drop in anything, I would argue is a revolution. It's a dramatic, dramatic challenge for every single organization in the world. So that's what we're faced with in healthcare. So how is healthcare responding? Well, healthcare, luckily enough for all of us, was already shifting to a value-based model. What is a value-based model? It's really the consumerization of healthcare and the delivery of value versus a fee-for-service type of model. In order to deliver on this type of new business approach, healthcare providers have to adopt completely different technology models that are outward facing. So not just accounting, EMR, inbound facing systems, but really truly technology that can allow them to reach out to the patient and to the community. So these systems are called telehealth and remote patient monitoring systems. The VA has pioneered telehealth in the United States. They already have financial impact data. They estimate right now that they have annual savings of about $6,500 per patient just with adopting telehealth. Self-insured employers, which we have a few in this area, of course, have observed an average of $200 in net savings per visits by using telehealth. And even more so, the shift to high deductible plans from the consumer standpoint is causing consumers to actually prefer and access the healthcare system via telehealth and remote patient monitoring. Of course, during the pandemic, on top of what you see here, it's not very wise for any healthcare provider to ask a patient suffering from multiple comorbidities, such as diabetes or hypertension, to come into a physical therapy practice just to make sure that they do their own exercises, as an example, right? So there is a lot that we can do remotely, and the pandemic is clearly accelerating the trend when it comes to the shift to delivering care remotely. So let's actually review some of this data and these trends together. So I try to actually summarize them for you in a couple of slides here. So just to give you an idea of the number of virtual visits in the United States in 2020, we will exceed 1 billion visits in terms of telehealth deliver visits. These are mostly synchronous visits, very much like we are on the webinar today. We're both at the same time in front of a computer or a screen. So that is synchronous. Remote patient monitoring is asynchronous. So I'm not even counting the remote patient monitoring components in here. This is the synchronous component. This really is a 300% increase in March and April. So it is really accelerating the adoption of telehealth by 3 years, quite frankly, right? This also has been helped or contributed to by the FCC funding through the COVID-19 telehealth program. The FCC is funding large providers like Mayo Clinic with millions of dollars to actually accelerate the delivery of care for non-urgent procedures via telehealth. So the 4 key market drivers, of course, beyond COVID-19 are summarized here, but really is cost, convenience, shortage of providers, which means we don't have enough doctors and nurses in this country with the huge geography that we have. And then, of course, the regulatory shifts that we briefly discussed, and I'm not going to go into that level of detail. That would require probably another half an hour. So telehealth really is a response both to the pandemic situation, but also to the rising healthcare costs. You see here that the global telehealth market is projected now to grow from $38 billion in 2018 to $130.5 billion in 2025. And of course, social distancing has propelled telehealth, and the rapidly ramping the physician hiring plans is leading telehealth companies to being able to deliver more services remotely. So you can actually add on top of that the increased demand for behavioral telehealth as well. So the good news is that telehealth, also because we are all working remotely from home very often, is being more accepted by the public. So Americans now say that during the COVID-19 pandemic, they have increased their willingness to actually receive healthcare services via telehealth. So 2 in 3 Americans right now consider that acceptable, which was not the case just a couple of years ago. And Stanford Healthcare has just published a study, which here they have seen a 50-time increase in telehealth encounters during the pandemic, which, of course, they have a population which is very high tech, but I would argue and make the point that we have a very similar high tech population here in our specific area. So we're not very dissimilar to what potentially we could see in the Bay Area, where Stanford Healthcare is, of course, located. So bottom line is, anything that was trending up before COVID-19 has been substantially amplified. So of course that has had an impact on the number of players in this market. Some of these players are new, some of these players are actually have been investing in this space, like Sensoria, for a number of years. But of course that has led to fragmentation. So what you see here is, I just tried to summarize, thanks to our friend at Cascadia Capital, the names of just the top players in each area of telehealth: synchronous, asynchronous, health assessments, and in-person and on-demand. Teladoc is, of course, the leader in the synchronous communication. As soon as I actually sent in my slides to the Bellevue Chamber, of course, consolidation, substantial consolidation has started. So you may have read the news last night, I believe. Teladoc has agreed to a $18.5 billion merger with another company called Livongo. You see it at the bottom right corner of the slide. They do chronic condition management, and that's RPM, remote patient monitoring. So you see telehealth and remote patient monitoring coming together. The difference between telehealth and remote patient monitoring is the fact that we're asking a patient to wear something, and that something could be a medical device. Very often it is a medical device. Very often is a wearable garment. Very often is a wearable wristband. Doesn't matter what it is. The data comes directly, not from the patient. It's not self-reported. It's data coming from the device directly into the patient's cloud view. So a clinician can monitor remotely his or her patient population without having a physical one-to-one synchronous encounter. So that's, I think, really, really, really important. And we'll see a lot more consolidation, no doubt, given how the market is moving and how quickly this market is maturing due to the pandemic situation that we discussed. So diving more deeply into remote patient monitoring is in itself a very deep and broad spectrum of technology. And again, I tried to summarize some of the technology providers in this slide for you. So there is specialty RPM, there is clearly adherence RPM that tries to increase compliance on the patient side. There is general RPM and wearables and personal emergency response system, PERS devices, which you're probably familiar with if you watch TV late at night. You probably have seen commercials of this type of technologies in the past. They are like fall detection type of devices as well. So Sensoria plays in the specialty RPM space, and we're one of the, I would say, leaders when it comes to deep clinical scenarios that are the most costly scenarios to manage at the country level, at the national level. So think about complications of diabetes with diabetic foot ulcers. We have a system that we designed with a top Italian and European footwear company that actually has been proven to reduce the risk of amputations for diabetic patients. We have worked with Cleveland Clinic on a smart knee brace to monitor the post-acute rehab after a total knee arthroplasty, which is a total knee replacement. So we can monitor range of motion of the knee. We can monitor the self-reported data by the patient, but we can also monitor each repetition during the 3 to 6 months journey that the patient has to go through to rehab to be able to walk again and go back to his own normality. We're announcing today that we actually have finalized the development of a product for wheelchair patients, wheelchair-bound patients, and actually, in general, individuals, I would say. They don't have to be patients. We have about 3 million wheelchair users in the United States. And we've built a Fitbit in a cushion for those patients to reduce the risk of ulceration. Those ulcerations plague our system, both financially and from a clinical perspective. 60,000 people die every year in this country because of that, because of ulceration. And so there is a huge need for deep clinical technology that can monitor patients effectively, efficiently, and remotely. That's why we are actually leveraging our Microsoft background and abstracting some of this technology in what we call the Sensoria Developer Kit. And we call it Sensoria Developer Kit because it's not just software. We have sensors, electronics, and cloud coming together that you can inject in an Intel Inside model into pretty much any type of wearable garment or footwear product, so that we can collect meaningful data from the patient and the user in near real time. But we talked about healthcare and we went quite deep on healthcare. I realized that most of the audience here is not healthcare specific. So what impact does this type of technology have on employers in the Pacific Northwest? So I will spend the rest of my time here very quickly walking you through what we're seeing, both here in Washington State at the national level, but also in Europe, when it comes to employers and their management of healthcare and health for their employee population. So you've seen probably in the announcement very recently, last week, I believe, that Mayo Clinic is actually investing $1 million of FCC funding to connect not just to consumers and patients, but also to the employers that they serve, right? So what can we learn as employers from this type of use of this technology? And as an employer, how can I manage the COVID-19 risk of infection, comply with the state and federal regulation, but also provide a service to my employees? The bottom line is that we are all in this together, and we need, unfortunately, new technology that needs to be developed very quickly to enable this new normal. We are not going to have a vaccine produced in volume for at least quite a few months, right? So, and even then, I would argue that there may be another infection. So how do we manage and reduce the impact of this type of situations in the future? So I tried to summarize here, and this is very superficial, of course. I encourage everybody to go to the website that I listed here for more details. But what we're trying to do here at Sensoria is comply with the Washington State guidelines on symptom monitoring, social distancing, and the PPE, of course, availability for our employees. So as you probably know by now, we need to screen the employees for symptoms, which means primarily temperature. We need to make sure that the sick employees or symptomatic employees stay home or immediately go home if they feel or appear sick. But how do we understand, how often can we monitor an employee? How do we know if they're mildly symptomatic, right? I mean, we all know that temperature tends to spike in the afternoon. The Washington State guidelines are telling us to actually monitor temperature at the beginning of each shift. That may not be enough to monitor the symptomatic patients at that point in the office, right? At 5 o'clock or 4 o'clock in the afternoon, that person may have a fever, and he or she did not at 8 a.m., right? So that is a challenge in itself, and technology can help with that, and we'll talk about that. And then everything else I will let you read. I know you're very, very familiar with some of these rules and guidelines, but at the bottom of this challenge, we are going to have two sets of populations, employee populations in our companies. We're going to have a somewhat immune population, and again, the researchers are not yet clear on how long the immunity and the antibodies to the COVID-19 will last, but it is safe to assume that they will last between 2 and 6 months at the very least, right? So we will have, if this virus behaves as any other virus that we know, we will have some immunity, at least for a subset of the population. The population could be 15%. Some people say 5%. Some people say up to 30% in just a couple of months. So we really don't even know percentage-wise how big the immune population will be. So the challenge will be to actually manage the non-immune population, which at the worldwide level, of course, we're talking about billions of people. So how can we do that? So what we are doing together with ecosystem partners in Europe and China and in the United States is propose a 3-phase approach to employee population health. And I will walk you through very, very quickly so that you can, start the conversation. We'd love to have a conversation with you. Actually, one of the proposed actions and next steps to my presentation here is to join forces and join our working group if you are passionate and interested, and we can actually work together on building the new normal. So how can we actually build this new normal in this three-phase approach? So at the end, we all need dedicated devices. We all need apps and mobile applications that allow us to monitor symptomatic patients and actually enable contact tracing efficiently as well in a privacy-protected way. We need the clinicians to be able to monitor remotely and predict the risk of infection so that they can manage ICU beds, as an example. And we hopefully also can provide citizens and employees with some type of boarding pass that allows us to have more freedom of movement in the future. So all of this can be engineered. There is nothing that is absolutely, sci-fi in this. We do have the technology to actually do all of this. So where do we start? So you probably know that Apple and Google have announced about 6 months ago, and they have now delivered the same type of technology that drives their payment system via QR codes into their own operating system. So Android and iOS have the ability to, in privacy-protected way, use Bluetooth to enable contact tracing of patients potentially, or people that have been in contact with patients that have just tested positive, right? So we can leverage this pervasive technology to help us in the future. So how can we do that? So in Europe, primarily, they have this concept called auto certification. So we can ask employees to basically auto certify. If they have a thermometer at home, obviously, and most of us do, we can ask them to actually test and monitor their temperature. They can do that multiple times a day as well, and auto-certify. That auto-certification, of course, can be led and fed into a cloud system. And of course, we can provide the employee with one of 2 QR codes. If the employee is immune, we can provide the employee with an immunity type of self-certificate or a self-reported status certificate, right? The self-reported status lasts a day. The immunity one will last probably 2 months, 3 months, 6 months, depending on what the CDC will tell us hopefully in the next few weeks here, right? But this can be done without having a mobile application installed on the phone. It can be done directly from the cloud. And so it can be deployed very, very quickly. Of course, the phase 1 has, of course, it doesn't escape any of us, the limitation to be self-reported, right? So people can be very, very disciplined and report correctly. People can make mistakes and report not correctly. So how do we solve that? We see employers building a kit, what we call the packaged COVID-19 kit, which is usually comprised of a blood oxygenation pulse oximeter monitoring device, a Bluetooth thermometer, and a mask. At that point, they can leverage their own mobile application or go through SMS or bot type of technology. In this case, the certification, as you can see here, is not just self-reported. In this case, is quantified, as we call it, right? So it comes from a device. So the QR code is color-coded. So a security person, a TSA agent can immediately see, as an example, if the person in front of him or her is just self-reporting a status, or there is a device providing continuously temperature monitoring and blood oxygenation for that person, which of course has a much, much higher level of accuracy and reliability. So in this case, of course, the device will present the QR code, and this employee can much more confidently, let's say, be allowed to access, a government building, a hospital, an enterprise corporate campus, right? So that can be done. But really, the ideal scenario is really to combine this type of engineered software system with appropriate hard and elegant hardware that can actually allow us to monitor and reduce the risk of infection. So I will walk you through 3 examples of the partnerships that we have in place with companies around the world, really and literally, to actually achieve that goal. Super excited about this, and this is actually the first time that we talk about it. So we're working with a company in the UK. The name of the company is UEarth. UEarth has designed since 2012 the most powerful bioreactors in the world. What that means is, think about an air filtering technology that leverages chemical war zone technology against the virus, which is amazing. So think about selecting natural bacteria that feed on the virus and put those bacteria into an air filter. These are healthy bacteria. They sit on water. They are not going to go into the air. The air goes through the filter, goes through that water. The water and the bacteria eat and feed on the virus, and the air comes out clean on the other side. Amazing technology, of course. Imagine in a retail store, imagine on an airplane, imagine in a meat packing facility, the impact that this technology, which is IoT connected to the Azure cloud, can have right now. The other technology that we're working on with China, of course, because we cannot reinvent the wheel, is create a Fitbit that is more specific to the challenges that we're facing. So we're now ready to go to production. Super excited about this, with a temperature and blood oxygenation monitoring device that can be provided to employees at $30 a unit, right? So this is something that can be given away and would feed into the quantified risk management system that I shared with you. So on top of that, of course, beyond temperature, beyond blood oxygenation, as you can see on my slide here, the same device can measure activity. The same device can measure sleep quality and heart rate. We all know that in case of infection, respiration rate changes and gets worse. So people tend to sleep worse when they contract the virus. So sleep quality is another potential predictive analytic indicator of a risk on that specific individual. He's not a patient yet, but he may become one, right? So by combining temperature, heart rate, sleep quality, and blood oxygenation, we can potentially predict the need for hospitalization, as an example. The other devices that we need to focus in on are masks. Of course, there is a huge and crazy debate about masks. In April, Wire magazine talked about this challenge and concluded that it's up to the engineers to build a new breed of masks that can actually protect the person wearing the mask and the person in front of the person wearing the mask, and that are comfortable enough and reliable enough and safe enough for COVID-19. The bottom line is there is no mask that can do that right now. That is unfortunately the truth for all of us. So what we're doing with companies both here in the United States, like ExxonMobil and others, we are creating that mask. And I'm excited about having material engineering, electronic engineering, and other multidisciplinary experts joining forces with us on creating such a mask. This mask will be comfortable, will be safe, will be reusable to reduce the environmental impact of throwing away hundreds of millions of surgical masks. You've heard me right. Italy is buying 1 billion surgical masks right now to serve 1 year. So even on the green and environmental friendliness aspect, we need to do this. And we are going to build a companion app that, of course, fits in the same system and dashboard so that the employer and the caregiver can actually, and even the government agency, can monitor adherence. Is the person wearing the mask? Is the filter still good on that mask? And the mask is going to be completely transparent. We're partnering with a European company on the aerospace filter. There is no textile in this mask. It's really very easy to breathe through. And our Sensoria core technology is going to do the monitoring of the mask in near real time. The mask filter is coated with biogel, very similar to the biogel that I talked about in the bioreactor. So by breathing through that filter in and out, we're pushing the 0.3 micron particles against the walls of that filter. And the filter has already been tested by Polytechnic of Singapore to be able to kill 99% of the virus and bacteria particles. So super, super excited about that. We're now, of course, extending that type of testing to our mask, but the filter itself has already been tested. Again, as I said, the mask is fully transparent, so we can actually, even from a behavioral perspective, we'll be able to see through the face of the person and see if the person is smiling or is not very happy. And that's part of being a human being, right? So that's part, I think, of the challenges of acceptance for some people of wearing a mask and making it easier for people to accept that we all need to wear a mask. Think about reopening sports and going to a Seahawks football game. We need this type of technology to be in close proximity with other people. We simply don't have a technology that is safe enough to do that yet, right? So having this type of technology, I think, will help a lot. This is just details on the filtering technology. As you can see, we have close to 100% probability to drag particles and impact the helix and the surrounding walls of the filter. And you can see the biogel, how the biotech engineered biogel works to trap and kill the virus inside the filter. And then the Sensoria core device will provide a green light or a yellow light or a red light when it's time to change the filter. We're going to monitor filter health in near real time. This is what the filter looks like. As you can see, it has nothing to do with the type of filters that we're wearing right now on textile masks. So this is a huge research and development effort for a small company like ours, as you can imagine. But I think this is the right thing to do. And so the exciting thing is that Microsoft and other companies are coming together with us and helping us create also the cloud infrastructure that allows an employer, a government agency, to have a view and assessment just looking at one screen at a glance, like in this case, from a geo perspective, geolocation view, what's going on in each office in the country, right? So we can have a risk index that we can actually design according to the employer guidance so that we can create this type of view, which is completely de-identified, is absolutely privacy protected. But in case that there is a risk of infection that increases above a certain level, then we can opt in as employees or have someone ask us to opt in for contact tracing. In this case, the data can safely and securely be de-identified. And at that point, as you can see here, I can drill down on John Smith. John Smith has an issue with temperature and blood oxygenation below the level of hospitalization. This is a threshold of hospitalization, actually. So John probably needs to be seen by a caregiver or a clinician at this point, for sure, even remotely via a telehealth visit, as we discussed at the beginning of this conversation. And then if I click on John Smith, as you can see here, I can see when and how the event happened. So I can actually help understand the people that were in a meeting or have been in close proximity with John Smith, leveraging the Google and Apple Bluetooth proximity technology, and inform the people that have been in contact with John Smith that they may need to be tested. So this is completely and remotely monitored. We don't need hundreds of thousands of people to do contact tracing. We can do this just by leveraging technology. So I think I'm out of time, but I really would like to leave you. I gave you a lot of information this morning, early in the morning. So, and it's actually Friday, right? So we'd love to hear your feedback here at Sensoria. You can send an email to info@sensoriahealth.com. If you're a public employer or a private employer in these industries, we'd love to actually work with you on a proof of concept. Of course, this technology needs to be integrated, both the technology itself, but also with your own internal systems. Think about an EMR system. So this is really an exciting time for us in technology, and we need your help in bringing this type of technology to reality as quickly as possible. So thank you for that. Joe, I pass it back to you.
Great, David. Absolutely amazing presentation, and a lot of questions that that we've got that I can't wait to shoot at you here. First off, just a quick question: if you have your camera and you're able to turn it on, we'd love to see you. But great presentation there. One of the first questions I want to start out with, and there's a lot of health questions and a lot of other tech questions, but I want to start off with an investor question, which is, this is a huge and growing industry: telehealth, telemedicine, health devices. What's for the investors out there? What's your biggest advice for them on how they can plug into the opportunity that this market presents?
Well, by now, I think most investors, both institutional investors and enterprise investors, understand the opportunity. I think even locally, we will see some transactions very, very soon in this space. As I mentioned at the beginning of my presentation, the market is very fragmented, so it will consolidate. The example I gave during my presentation is just one of the largest. It's a multi-billion-dollar merger between two public companies, right, that work in telehealth and remote patient monitoring. And we'll see a lot more of that happening in the next months to come, for sure.
That's awesome. One other thing that came up a lot in your presentation was around just the ubiquity of these devices, and you could have them in all of your clothing, and they could be live streaming data to all corners of the earth, whether it be your doctor or a specialist or to a provider that's monitoring for workout data and things like that. And we've seen more and more of that coming all the time. How does this meld with the privacy concerns that come up so often, especially as we see things like heart rate and EKG and other things actually starting to be used for data storage, data security, password and biometric access and things like that? Is the public ready for this, or is this just the natural next step, and the security issues will take care of themselves?
Look, I hear people saying that there is a trade-off between privacy and safety. That used to be true. It's not true anymore. I can tell you that if we do things right, and I think companies like Apple, Google, and Microsoft definitely want to do things right. We have the technology building blocks to do both, to keep people safer and respect their privacy. And it's going to be an opt-in model, very much like in the HIPAA regulation and in the European regulation, which is actually for non-patients like employees and individuals, more stringent than it is here in the United States. There is absolutely a way to comply with that. It's like, and again, if people don't want to share anything, that's fine. But in this situation, I think, given how nasty this virus is, even when people are non-symptomatic, they're actually a threat, right? So I think it's up to us to be, participating at the level that we feel comfortable with in solving the problem, or the problem will just take longer and it will be more costly to solve, and unfortunately, we will have higher mortality rates for a long, long time to come.
One of the things you brought up there, both in your talk as well as in your answer just then, is about the role of the federal government and state regulation and how it impacts the health of this growing market. And so I guess one of the questions is, given our healthcare system, given the payment system, the third-party payment system, whether it be Medicaid, Medicare, the various insurance companies, how have these entities viewed the shift towards telemedicine? Because if it's not being compensated, if there isn't a reimbursement model that makes these types of devices affordable, makes the servicing of these devices compensated, and makes the treatment that's provided by doctors, reimbursed at commensurate levels to inpatient care, the incentives just aren't there to make the switch. So how are those incentives shifting? How are these entities looking at these technologies as being the future, or are they fearful of the type of disruption that they might represent?
Okay, that's a great question, and that used to be true, but it's not true anymore. Actually, incentives have never been so aligned. Some of these rules have been relaxed by the federal government with the emergency response. So telehealth is absolutely reimbursed in this country. I just want to highlight that. Probably the US leads the way in reimbursement for telehealth services. On top of that, in 2019, a regulation that passed super quietly and was completely ignored is a wonderful regulation. It's an RPM regulation. And in the physician schedule for 2019 and 2020, you will find 5 new CPT codes that actually reimburse physicians for not just telehealth, but RPM, but asynchronous remote patient monitoring. So looking at the dashboard, the cloud dashboard, and the data of the patients remotely at the end of the day or the beginning of the day is absolutely reimbursed in this country. So we're moving in the right direction. Yes, there is always work to do. Incentives are never always 100% aligned because, reality and legislation, there is a lag between the two. But I would argue that we should not hide behind the finger of reimbursement because the finger is not there anymore. So we can't hide.
One of the questions that's come up on the chat panel, I believe from John Milbrath, the chair of the Bellevue Chamber, is about the issue of access and who's the market that's using these products. We know that over 72 million Americans don't have a smartphone. We know that tens of millions of Americans don't have broadband internet access, and we know that the technology divide is pretty significant, particularly across age demographics, as well as oftentimes in communities of color, and oftentimes in communities lower income communities. So, given those stats, how do we make this technology more accessible, more available, and more usable for those populations? And right now, what populations are we seeing that are really using this technology?
So that's another fantastic question. So just to be clear, chronic illnesses account for 75% of the healthcare cost in this country. And the top 10% of the pyramid, the top 10% of the patients are accountable for more than 80% of the cost. So if we focus on those two items, we think that we can do good and do well, right? So, but even when it comes to the aging population, the aging baby boomers, all of us, are aging quickly. And so we grew up with Excel, right? We're quantified, right? We want to know what's going on with our bodies and our health. So there are 28 million households in the United States when it comes to the 11 to the aging population. Think of right now, if I'm not mistaken, the numbers are 100 million people age 50 and above in the United States. Over 20% of the population in the US will be above 65 years of age by year 2040. So most of these people grew up with technology, right? So again, yes, we need to realize where we are. Only 20% of the elderly population right now owns a smartphone, and we need to recognize that, right? But 90% own a cell phone, and that's why you've seen that our approach in phase 1 and phase 2 doesn't rely on downloading mobile apps. We need to be able to provide a text message to the people that don't have a smartphone and still be able to have some type of interaction with these patients. And Overlake hospitals and Swedish Hospital and others have already started that conversation right now. So we do have the infrastructure to do that right now.
disruption to the existing healthcare system that these kinds of technologies and services present, especially when you start mixing the device world with things like artificial intelligence, deep learning, and things that can actually do higher level diagnosis work. What do you view the healthcare industry looking like in a decade or so? You know, because we've gone from this slightly more decentralized model where you had a lot of independent providers and clinics, and then after the passage of federal legislation, you saw a huge consolidation as folks started to, team up, and the medical center hospital model became more dominant. Where does the future take us with this type of technology?
Well, that's a question that is really hard to answer. But one thing that is for sure going to happen is that technology is going to be a lot more pervasive in healthcare than it used to be, right? So bulky medical devices will give way to miniaturization, and the convergence of value-based care that I talked about with the lack of sufficient clinical staff. Think about China, 1.4 billion people, 30,000 physical therapists. It takes 5 years to certify a physical therapist, even in China, right? So how do you serve a 1.4 billion people population in rural area without technology? So again, there will be a major shift. And quite frankly, very much like for all of us working from home and using different tools, clinicians and other healthcare workers will have to adapt quickly to new technology and new operational models, for sure.
David, thank you. David, thank you so much for being with us today. This was an absolutely incredible conversation. I love the messages. I was getting some of the private messages as well, just from folks that are really blown away at what you're doing at Sensoria. Where's your headquarters located?
Downtown Redmond.
Downtown Redmond, right here on the east side.
Yes, sir.
Thank you so much, David of Sensoria. We really appreciate you being with us here today. Thank you.
Thank you for having me. Stay safe.
Thank you so much to all of our speakers for your participation today. And again, if you have not had the opportunity for registering for next week's program, you can do so right now at the pop-up on your screen or anytime at bellevuechamber.org. Don't forget to tag us on social media at Bellevue Chamber for a chance to be featured in an upcoming webcast and a chance to win some of those great PPP. We also have another program coming up next week on Tuesday. I want to invite you to register for this program with Senator Patty Murray. It's going to be Tuesday morning at 10 a.m. It's hosted along with the Seattle and Pierce County and Tacoma Chambers, as well as the Economic Alliance of Snohomish County. Senator Murray will be joining us to update us on pending COVID relief legislation in the other Washington and to take your questions. So click the link to register and join us on Tuesday morning. As always, we've got one more thing before we break for the day. Amazon has provided an Echo Dot to raffle off each week. And so we take a look at who's on our call today and draw from the audience, roll on through and give it a chance. Let's make sure that this is the final spin. And there it is, your winner for the day. Michael T. will be in touch with you to get you your Echo Dot. Congratulations, Michael. If you'd like a shot at winning a Dot on August 14th, get registered right away and join us. I want to again thank our presenting sponsor, Amazon, our major sponsors, AT&T, Microsoft, Puget Sound Energy, King County, and the City of Bellevue for always supporting us. As always, stay safe, stay healthy, and we'll see you next week. Thanks for joining us.